Olunaku olwaleero nkuleetedde ekyenjawulo era nga nkuleetedde essomero erisomesa abasawo nga lino limanyikiddwa nga Bukedea Health Institute. Essomero lino likyali ppya katale wabula nga lirina beerako nti likusomesa abasawo era nga lisomesa ku mutindo ogw'ekika ekyewaggulu. So olunaku olwaleero babadde n'okubangula abayizi abapya kiyite orientation mu kubateekateeka butya balina okweyisaamu, mateeka ki ge balina okugoberera n'ebirala ebiringa ebyo ebibeera mu kye bayita orientation. Era nga ku bimu bye babakuutidde kwe kuba nti beewalira ddala ensonga y'obusosoze mu mawanga, kiwandiise tribalism. Lwaki kiri bwe kityo? Essomero lino lisangibwa mu bitundu eby'etteeso wabula nga mulimu abava mu mawanga ag'enjawulo, ogeza nga Bugisu, Bukeddi n'ebitundu ebirala ebinaanye etteeso, oba oliawo ne Buganda n'ebirala okwetoola eggwanga lyonna. Wabula nga abayizi ebiseera ebisinga balina omuze gw'okuba nti bakola bukakuuni oba obukundi, bagamba nti ffe tuli Baganda tulina soma ffekka, ffe tuli Bateeso tulina soma ffekka, ffe tuli Balulu tulina soma ffekka. Babakubiza ne bagamba nti ekyo balina kyewalira ddala kubanga bonna bali ku ssomero eryo ng'ekibatutte byakusoma era nga ekigendererwa balina kimu kusoma nakuba nti baweereza eggwanga lyabwe. So we baba nti bakubaako nekibatuukako balina okuba nga beewalira ddala ensonga y'okusosolagana mu mawanga wabula abe nga bonna bakisa kimu nti bayizi era abasoma okulaba nti bakuuma obulamu bw'abantu. Okusinziira ku Ogen Peter ng'ono ye Dean of Students oba avunaanyizibwa ku bayizi yategeeza nti bo ng'essomero beeteefuteefu okuba nti bakuuma abaana mu mbeera ennungi, kiwandiise welfare, muli okulya obulungi, osula obulungi n'ebirala, era nga abayizi tebagenda kuba nti bataataaganyizibwa. Ye Ewiru Tony ng'ono ye academic registrar avunaanyizibwa ku byenjigiriza mu ttendekero lino agamba nti bo ng'essomero beeteefuteefu okuba nti basomesa abayizi ebyo bazadde baabwe babasuubiramu oba nga nabo abayizi bye balina okuba nti basoma okulaba nti bafuuka abasawo ne ba midwife ne bannansi abalungi. Ate nga omukyala Erebu Margaret Florence ng'ono principal w'ettendekero lino agamba nti bo nga bo omugumu ku mulimu omukulu kwe kuba nti basomesa abayizi ababa baleeteddwa okulaba nti tebavaawo nga we bajja, bagenda okuvaawo nga bafuuse abantu ab'enjawulo era nga eddimu eryabwe ekkulu kwe kuba nti basomesa abayizi bano awatali kwekkiriranya wabula okuba nti babateekamu amagezi ge balina okuba nti bafunda. Essomero lisangibwa kilomita 2.5 okuva mu tawuni y'e Bukedea ku luguudo oluva Mbale okudda e Soroti oba kiyinza okuyita Soroti Highway. Weliri awo liri ku kkubo era nga lisomesa bulungi, lisomesa nursing ne lisomesa ne midwifery awamu n'amasomo amala. Katugatte ku bakulu bano ku orientation nga byatambudde.
The goal or to become competent, you need to abide by the rules and regulations of an institution. Actually, when you abide by the rules and regulations of an institution, you would have not gone wrong. That one alone will guide and lead you. Because by you being here, you are targeting at something, of which you have to be determined to reach there. And how do you determine?
Avoid tribalism so as to achieve what we have come to get from here. I'm Dean of Student and my name is Ogen Peter. I'm a midwife. People, you clap. Have you ever seen a midwife? You have never, so you need to clap 2 times. I'm a midwife and I'm a tutor. Just the way head of midwifery introduced or explained to us meaning of midwifery, we don't separate midwives from nurses. We work together. That's why you saw me teaching you microbiology. Some sets I taught them anatomy. We learn the same things. Difference in the specialization when you go up is when we need separate classes, and for nurses you may rarely see in your class when you go up there. What is my role as a dean of students to you students? Because at this level, some of us might be hearing this one for the first.
My name is Ogen Peter, the Dean of Students of Bukedea Health Institute, one of the greatest institutions in Uganda. 2 years old, but so far the milestone is very serious. Today we have our orientation for the set 5
They started reporting on 6th, and today 17th, 15th, Saturday, we are orienting them to the institution. Currently, there are 80 students who have reported, but we are hoping to receive about 200. It has been a good day. We have taken them through rules and regulation. That's as per my office. And I want to inform us all out there that Bukedea Health Institute is following the rules and guidance from the Ministry of Health and also the governing bodies, that is the uphold and the council, Nurses and Midwifery Council. And we are not very far from them because we are following their rules and regulations. And while at Bukedea Health Institute, your students is a guarantee of safety. Here we have students from all over different parts of Uganda. Currently we have students from Western Uganda, we have students from Northern Uganda, we have very many students from Busia, Tororo, and very many. In fact, our national presidents from Karamoja region. And also with the staffs, here we are mixed. Like if you go to different offices, our academic registrar is from Northern. Personally, I'm not born of this area. Therefore, Bukedea Health Institute welcomes all forms of tribes. While you are in Bukedea Health Institute, you'll be sure of free interactions, free guidance, and the professional development of your child. Concerning tribalism, I remember eating about it when I was giving my speech to students, and I remember informing students that so far we have not registered any form of tribalism, and I remember discouraging them very much from any form of tribalism, because here we live as a family, and the language we use here which unifies us all is English, because even staffs, they are not from the same region. They don't listen to one another's language. We use English, and while in the dormitory, we don't have dormitories according to tribes. We have dormitories according to sets. We have dormitory like that we occupy 4 halls, and they are for sets, not for tribes. While at Bukedea Health Institute, we are very serious with any form of tribalism, and we are very sensitive. If we notice, we treat it with the maximum seriousness. But so far we have not noticed any, and we appreciate our students for that. As Dean of Students of this great institution, I want to report to us out there that so far our welfare in terms of accommodation is very well. In terms of meals, I want to report to us there that our meal is okay. Once in a while during break time, we serve milk, we give bread, that's mandazi, to every student. And during lunch hour, we change meals. At least in a week, we eat meat twice. That's Wednesday and Saturday. And also we eat rice twice. And once in a while, we serve all our students with eggs and yellows. When you interact with your students, your children, just be sure that when they are leaving Bukedea Health Institute, they are going to reach home when they are very healthy, and they will be reporting to you positively about Bukedea Health Institute. Concerning entertainment, we have DSTV in our dining hall, which accommodates currently all the learners, and we make sure we subscribe. And within the institution, we have Wi-Fi in every angle of this institution. Our institution is very large, but we have Wi-Fi covering all the premises. Even when students are in the dormitory, they are able to go online.
Call me Irebu Margaret Florence, just as simple as that. I am the principal of Bukedea Health Institute. And Bukedea Health Institute, I may say, is positioned about 2.5 kilometers from Bukedea Town on Mbale Kumi Highway, or Bukedea Kumi Highway. And here, we are here to train medical personnel, and basically nurses and midwives at certificate level. And here we are planned to groom and bring up people whom we feel are people who matter to the community, to the district, to the region, to the nation, and internationally. Why do I say internationally? Because when we're dealing with a human being, we're not specific, picking one. So we are able to handle internationally. So we train our students so that they will qualify to work in whichever part of the world. And we encourage even more students and more parents to come and join us, because we look at a scientific aspect of handling human life, and we look at seeing them come up as right people to serve. We always look at the field as a field which we would call a backbone, because without health, there's no service. Because even you yourselves, if you're not healthy, you will not work. And once you feel any disorganization somewhere, physically, you need somebody who will handle you. And here we are looking at training people who will come up whole round to handle patients, not specifically a disease, but to handle a human being when he's ailing, should be handled as a whole. Someone should have knowledge of whichever part of the body of a human being, so that when we deal with somebody saying that I am ill, we don't look at only that portion which somebody is complaining of. I want to give you an example. If you say that you have maybe an ear paining you, the ear will not remain alone. It is on a human being, and it will radiate to other parts. You will find it radiating to the cheek, it will radiate to the mouth, it will radiate to the brain. Because once that pain is there, the brain is disorganized. So we're training our people to get to know each and everything. And we're looking at it as having people who will come out as round people to handle our humanity. And we encourage people from all over the country, parents to send us their children, students to come here. Why? Is because we are a nation. We are not specific. We are multi-people. And you'll find that even in our service, in the staffing, we don't have a specific tribe, but we are multi-tribal. So we encourage each and everyone to come and study in Bukedea, even across the country or outside the country. We welcome them, because this is to be a home of training and training people who will matter wherever they will be, not in one specific point. We want to see to it that healthcare is driven whole around everywhere where the health workers will be. Because today we wouldn't love to see communities really move to look for healthcare in very far areas. But if we have them trained and all over, when we have them dotted everywhere, we are sure that people will be getting services at the right time appropriately. I know there are outcries of people moving long distances seeking medical care, but once we have these people trained and they're willing to work, because that's one other aspect we have to put into their mind, that they must be willing to work anywhere they are sent to work. They must serve. And they must serve with a godly heart, knowing that everybody is a human being, irrespective of the status, the tribe, the age, the religion, the language, and whatever. Yes, midwives must be able to handle mothers with their pregnancies and their babies and even in their ailments. They should be handled and handled properly. So we are here to train people technically to know what exactly they are to do. Training, and also we deal with clinical training. When I talk about classroom training, we handle them in class, handling different course units, but which all zero on a human being. Then after that, we have to look at it in a clinical aspect. We make sure we have liaised with the different health facilities where we take our students to practice. And we have no problem, no challenge over that, because at least we are well positioned to have our students practice clinically in whichever clinical environment there will be. So we encourage more and more students to join us. Because of that, we have no problem of saying we have nowhere to place them. And we have trained and well-trained teaching staff I am proud of. And when I talk of that, I don't feel embarrassed over any, because I know that they are capable of bringing up nurses who will be capable to handle patients in the right way, at the right time, in the right places, at the right position, at the right orientation. Orientation is bringing them to get to know what is in this place, to get to know first that this is going to be their home, to get to know the norms, what they're supposed to do, to get to know which direction they're supposed to take, to get to know the rules and regulations, which are not specifically for the institution only, but they are right from the ministry and which are national and international. So we have to put them in the know of what they're supposed to do and what they're not supposed to do, where they're supposed to be and where they're not supposed to be at what time. They have to know and respect whoever is around them as they respect themselves. They have to know how to cooperate and coordinate with they themselves, with the staff teaching and non-teaching, and with the communities. Because when they get oriented, even when they go to the field, they'll go knowing what exactly they're supposed to do. But if you bring someone and you do not orient a person on what he or she is supposed to do, where to go, you'll find that they'll move anywhere, anyhow, which we are trying to avoid. And we try to see to that when they are oriented, they'll be able to guide themselves and guide one another in whatever they are doing. And there will be people who will be responsible when they're oriented and they know what exactly they are doing. They'll be knowing what they have come for and what they want. When we look at the tuition, our tuition in actual sense is supposed to be 2,350,000 per semester. But looking at our communities, looking at the welfare of our people, we decided, and directors looked at it right, to help the parents and see how do our students enter the institution. So we decided to give them a bursary, which we would call a full bursary on tuition, and they will only give a contribution on the hostel and meals, yes, on entry, that is in the first semester, and the medical fee in case of any emergencies. Those are just those emergencies, which makes them pay a tuition of 750,000 shillings only. That is what comes to the school. Then the other requirements are paid fully, and there are those requirements which are paid once for the whole course. And those are requirements like the uniform. They pay it once, unless the student spoils the uniform, unless the student loses the uniform, but they pay for the uniform once. And then they also pay for what we call the assessment or record book. There are two different books. Assessment book is for midwives, and then the record book is for nurses. These ones are paid for once, and all these monies will be going to the ministry because we don't get them from here. Those books, when they pay, we receive that money and we deposit in the account which is in the ministry at the uphold office, and then we pick them at the time we are asked to pick them. Also for the school ID, they pay it once. Then there are items which are payable every semester. The exams, they do 2 exams, the mid-semester exam, and for those who have just come, we call it the PTS exams. That is the mid-semester assessment. Then they have the end of semester assessment, which is the uphold exam, which also is payable every semester throughout the time. Then the clinicals, that is when they are going to the health facilities for practice, it is also payable every semester because that money doesn't remain in the school. We collect it at school and we pay it the health facility at once. And this money, when they have been given this bursary on entry, it saves them the money which they will help to pay on these other requirements. Because if you subtract 750,000 from 2,350,000, that other money will help you cover up this, which brings them again to about 710, 705, and they will still remain with a balance of the money. So it will have helped them to clear in the first semester at least everything. Then the subsequent semesters, they will still have a part bursary of 800,000, and then they will be paying 1,550,000 every semester. Apart from those other things which may come in, like if they are to go to the community, they have a contribution they pay for going to the community, because they have to go to the community. Each group must at least go to the community to have community experience, to know how they handle the community. What do they do? Because when we teach them primary health care here at school, yes, and personal communal care, we have to take them to the community so that they know what do we mean by this, what is done in the community. They have to bring the community to know how to take care of their houses, how to have kitchen and bathroom and pit latrines and so on and so forth. Yeah, so there they contribute something, and that is just how their money is. That money which is paid once, and it is once. Logbook is paid for once, but if a student loses the logbook, then they pay for the logbook, the money which goes to the other side, and it will go about 4 times. And when they pay that, they also have to pay the transport of somebody who is going to pick the logbook, because it will not be in the school program, but it will be in your personal program because you lost the logbook. And it will also go with a written document by the student who has lost the logbook. If you lost it anywhere, it must be accompanied by a police letter to show that it was indeed lost. If it is a tutor who has lost it, if the principal loses, the principal must pay for the student's logbook and must face everything.
You're most welcome to Bukedea Health Institute. Bukedea Health Institute is located in a very central position along the highway going to Kumi, that is from Bukedea Town. And as an institution, we are existing to ensure that we bridge the gap in healthcare services, especially bringing out students who are able to handle patients professionally with a lot of care and commitment. Now today is a special day to us as an institution. We have orientation of our dear students who have just reported here semester 1. We felt this is a very important activity because every home has different cultures, every home has different norms, So orienting them is indirectly a way to show them how we do it in Bukedea Health Institute, how we are able to handle matters of academics, how we are able to handle matters of clinical placements, how we are able to handle social matters and different activities as far as training them in healthcare management is concerned. So it is basically a reason why we felt this is very important. So every parent outside there, Bukedea Health Institute, the gates are yet open, and we invite still those who have the students, the children outside there who have completed their senior 4 and have not yet been placed anywhere. We still have vacancies available so that you can join us, and together we are able to support your child to be in position to acquire that dream in the medical field. Bukedea Health Institute is located in a very conducive place. It is far from a lot of distracting factors academically, but also why you'd choose us is in terms of academic resources. We have enough resources that can support the child to attain their dreams in the medical field. A well-stocked library. We have a computer lab that is functioning. And when you're in Bukedea Health Institute, you cannot go back without learning computer skills. We have a very well-established skills laboratory where our students are trained hands-on, and as they go out to the world, they're able to surely portray the picture of a health worker that everyone would want outside there. But also as an institution, we are very friendly in terms of relating with the community. Before you know it, our students, our children will go to the community outside there. So we teach them how best to relate to the community, the people they are going to work with, and basically we emerge the best out of that because our students show exemplary skills.
I'm called Mbale Jonah. I'm doing a course of nursing in Bukedea Health Institute. The institution is okay, and we have peace, we have everything here. So anyone outside there, if you want to do any course of nursing, you can come to Bukedea Health Institute. Here in nursing, we learn very many things. In the orientation, what have we learned from there? They told us you have to work with the administration. You have to build the confidence of taking care to the patients, and also you have to listen to what the teachers tell you.
My name is Roda. I'm a nurse at Bukedea Health Institute. About our school, have friendly administrators, the people are caring, have like good feeding. To the side of feeding, they feed us well, have safe water, taps, there's many. Good network like Wi-Fi is for free. The orientation is helping us to know some places which we don't know, like we are new. We are knowing library, computer labs, dormitories, places where we don't know, like bursary offices, some offices like for administrators.